Hello dear all. In this presentation, we discuss posology in homeopathy. So, posology is study of doses. Posos means doses, logy means to study. So, dose is nothing but the quantity of medicine recommended at a time. What is potency? It is the power to influence. Potency is that dynamic power to influence the vital energy in patient. What is Finck's law? So, law of least action. That is quantity of action necessary to produce any change in nature is least possible. So this Finck's law helps us to understand the minimum dose which Dr. Hahnemann has advocated. So law of minimum. So it is related with Finck's law. Finck's law says that law of least action in nature. So quantity of action necessary to produce any change in nature is least possible. So any phenomena to take place, the stimulus required is very much small, least possible. What is Maupertius' law? He was a French mathematician. He stated that the extension of the Finck's law, that the decisive amount is minimum, always infinitesimal. So, what Finck is saying? That the law of least action. It means what? What is that quantity of action necessary to produce any change in the nature is least possible? An extension given by Maupertius. The decisive amount is minimum, always infinitesimal. So, posology is study of doses. What is physiological dose? It affects the functions of individual. What is the lethal dose? It is the amount of dose which is fatal to the individual. According to Paracelsus, every drug is poisonous as well as medicine. So physiological dose, that dose which stimulates the functions of various systems or organs. Physiological action, not curative, and it is not in homeopathy. So what is there in homeopathy is the dynamic dose. What is dilution? It is reduction in the concentration of active substance by addition of neutral substance. So dilution is what? Reduction in the concentration of active substance by adding some neutral substance. What is infinite dilution? More dilute the solution, greater number of ions. Complete ionization and absolute dissociation are possible only in infinite dilution. So we understand what is the quality of dose in homeopathy. It is the infinite dilution. So more dilute the solution, greater is the number of ions. Complete ionization and absolute dissociation are possible only in infinite dilutions. So, what is the law of ARRHENIUS? Higher the dilution, higher the ionization, and therapeutic activity is greatest at highest ionization. Thus, law of ARRHENIUS helps us to understand the doses in homeopathy. How much is the dose? It is the higher the dilution. So the dose in homeopathy, Dr. Hahnemann named first as dilutions. Now he diluted the medicinal substance and he went on further diluting the medicinal substance. And what happened is explained by law of Arrhenius. Higher the dilution, higher the ionization. And therapeutic activity means the action of medicine is greatest at highest ionization. What does Arnold Schultz law says? The small dose stimulate, moderate dose inhibit, and large doses kill. This underlines the importance of small doses. What is lethal dose? It is also called as fatal dose or toxicological dose or narcotic drugs. Amount of dose which causes death of living being. What is booster dose? Which enhances the action of initial dose. What is fraction dose? Fraction of full dose. So it is the small amount of the full dose taken at short intervals. Now, what is the study of doses in homeopathy? So, Dr. Hahnemann is giving us the laws of similar, law of simplex and law of minimum. Hence, the homeopathic remedy is a similimum. It's a single dose, it's a minimum dose and minimum repetition, and it's infinitesimal dose. Now, as we saw the various laws, that is FINCK'S law, Maupertius law, Arnold Schultz law, ARRHENIUS law, they all are having the most important point is that the quantity of the dose in the smallest quantity is very important and it has got greatest therapeutic activity. So what is a similimum? It is a remedy capable of producing set of symptoms and is able to cure same symptoms. Thus, disease curing power is disease producing power. So, the symptoms which that medicine produces in the healthy prover, same symptoms, if observed in the patient, medicine acts curatively. What is the single dose? Vital force is dynamically deranged and morbid symptoms represent the disease phenomena. Only one similimum with its dynamic hidden powers will be given to remove this morbid phenomena. So only one remedy at a time is required because vital force is dynamically deranged and morbid symptoms are representing the disease phenomena. Thus, only one similimum with its dynamic hidden powers will be given to remove the morbid phenomena. The minimum dose. It is the smallest amount of medicine just sufficient to stimulate the vital force. Dose cannot be made so small, otherwise it won't act. Mother tincture biochemic remedies are minimum dose for that patient. Thus, mother tincture biochemic remedies contain the crude substance of the drugs, but they can be considered as minimum dose for that patient. So, it is the smallest quantity of medicine just sufficient to stimulate the vital force. So if in the case of renal calculi we are giving Berberis vulgaris mother tincture, then also for that patient the mother tincture of Berberis is the minimum dose. What is infinitesimal dose? It is the infinitely small dose. After sixth potency in the centesimal scale, no drug substance remains and there is no upper limit to divisibility. It is highly dynamic dose and highly potentized dose. So infinitesimal dose is always highly potentized. It never contains any crude drug substance. So mother tincture cannot be infinitesimal dose. Biochemic medicines in the 6x, 3x, they are not infinitesimal. So infinitesimal dose is the after 6C there is no drug substance present, and if we go on increasing the potencies, they are highly dynamic doses, highly potentized doses. What are the general guidelines for posology? Let's understand. So higher the matching of remedy with the totality of the patient. At which level? At the level of MG, PG and PP, means mental generals, physical generals and physical particulars. So higher the matching, remedy is getting matched at the level of mental generals, physical generals and even at physical particulars, we consider indication for higher potency. Then closer the correspondence of remedy with totality of symptoms, again with respect to mental generals, physical generals, we consider it is a high potency. High mental symptoms in the case, we consider higher potency. Allergic patients, moderate potency is given. If reached highest potency in the scale, then come back to the lowest potency. Thus, if we are treating a chronic case, we are increasing the potency over a period of time. And if we reach to the highest potency, then we can come back to the previous lowest potency. So pathological cases, low potency is given. As we saw, very important aspect, if there are high mental symptoms in the case, higher potency is selected. If it is a pathology, then lower potency is selected. Remedies inert in the crude state, high potency gives better result. So what are the indications of high potency? What is a high potency? 1M and above are high potencies. So high mental symptoms in the case is the most important indication of high potency. Higher matching of symptoms with totality. So the entire totality in the patient is matched with the remedy at the level of mind and body, then we select high potency. Highest correspondence at mind level. So classical mental symptoms of the patient are matched with the remedy to the greatest extent, then we select higher potency. Nosodes are given in high potency. So tuberculinum always given in the high potency. Syphilinum given in the high potency. If previous potency no longer acts, go to the next higher potency. Now what are the contraindications of high potency? Pathological changes present is a contraindication for high potency. Pathological changes in vital organs. In such cases, high potency is not given. So, in these cases, we have to give low potency. Biochemic medicines are not given in high potency. Organ remedies, mother tinctures are not given in high potency. Now let's understand what are the indications of low potency. What is a low potency? 30C, 6C, 3X, MT is mother tincture. So pathological changes if present is an indication for lower potency. So in this case where symptoms of disease predominate is an indication for lower potency. So pathological changes in vital organs is an indication for lower potency. Matching of symptoms at organ level is an indication for lower potency. So matching is only at particular symptoms, not at mind. We are going to choose lower potency. Correspondence at particular symptoms calls for lower potency. So particular symptoms are only matched, or we are giving organ remedy. Organ remedy means like berberry is given for renal calculus, sarulata given for prostatic enlargement. So here only matching of symptoms at organ level. Then we select lower potencies. Biochemic remedies are given in low potencies. What is contraindication of low potency? Higher mentals in the case, allergic conditions, nosodes are not given in low potency. So, in conditions where allergic conditions are there, we don't prescribe lower potency. If high mentals in the case, we don't prescribe the lower potencies. Indications for moderate potency, that is 200, is allergic conditions and hypersensitive persons. It is a safe potency to use. What is contraindication for moderate potency? So there are no particular any contraindications. What is the time of administration of potencies and with our remedies? So constitutional remedy is given at night. Sulfur is given in morning and Nux vomica given at night. Nosodes are given at night. In patients of asthma, acute condition, superficial remedy is given followed by constitutional remedy. So in patients of asthma, if it is acute condition, acute attack is there, then superficial remedy is given and then it is followed by constitutional remedy. In patients of menstrual irregularities, constitutional remedy is given at the end of previous cycle. So vital force gets time to act. So we come to know the result in the next cycle of the patient. Okay, and then we can observe the response. In acute diseases, as disease is acute type, it is fast progressing. Remedy is given in repetition to counteract the progress of the disease. So in acute disease, as there is a fast progress of the disease, remedy is given in the repetitions. Action of remedy is known to exhaust early, so frequent repetition is required. So we can give daily or we can give frequent repetition like 4 times a day also. Remedy should not be administered either before or during the period of aggravation. It should be administered after the period of aggravation. Disease is characterized by periodicity. Deep acting remedies should not be administered just before or during the paroxysm. So, if there is periodicity, then remedy is not given just before or during the paroxysm to avoid aggravation, if any. In patients of epilepsy, acute condition, superficial remedy is given followed by constitutional remedy. What is the Roberts rule of repetition? As soon as adequate response is observed, further repetition is stopped. As long as response continues, remedy is not repeated. So, rules of repetition in chronic disease. As disease is of chronic type, single remedy is given in single dose. Multiple dose stimulation is given when single dose repetition fails. So, in the functional pathology, usually we have to administer single dose stimulations, and in the structural pathology, multiple dose stimulation is very important to give the results. Okay, so this discussion was on posology. What is high potency, medium potency, low potency, their indications, contraindications, and various rules of repetition. Roberts' rule of repetition is as soon as adequate response is observed, further repetition is stopped. So as long as response continues, remedy is not to be repeated. So in chronic type, single remedy is given in single dose, whereas in the multiple dose stimulation is given when single dose repetition fails. If pathology is functional, we are usually giving single dose stimulation. If pathology is structural, multiple dose stimulation is given. So that was about the discussion on posology. Thank you.